Hello everybody, my name is Dr. Sonal Bondre. I am a consulting physiotherapist practicing in Mumbai since last 18 years. First of all, I would like to thank Arogya Mitra and HealthPals for creating such a wonderful platform where people can reach out for genuine and authentic medical information. Today I will be discussing with you about a very common postural problem called as forward head posture. You may have also heard of the terms such as text neck or eye hump. They all mean the same. With the onset of Corona and the lockdowns, we are spending far too many hours on our gadgets, be it mobile phones, iPad, laptops, desktops or your computers. So the use of these gadgets is giving rise to a very peculiar kind of neck pain. Now there are many causes of neck pain, but today I would be talking about the neck pain peculiarly caused due to this forward head posture. What exactly is forward head posture? So a forward head posture is a posture in which a person thrusts his head too forward than his body and torso. As you can see in this slide, the continuous forward thrusting or bending is giving rise to a compensatory rounding or hunching of your upper back. Sometimes, if this posture was uncorrected for a long period of time, it also gives rise to a hump at the base of your neck with your chin poking out, which is also called as a Dowger's hump. Let us just see how heavy is your head. Suppose your head weighs 12 pounds in a normal or an ideal alignment. Then with every inch you are bending your neck forward, it can increase the weight of your head on your spine with an additional of 10 pounds. So imagine how hard your neck muscles have to work in order to hold your head upright. So this is constantly putting a strain on the muscles of your neck, eventually leading to a spasm and pain in the neck. What are the causes of this forward head posture? Forward head posture can be caused by too much time spent on computer in a static posture, carrying heavy backpacks or loads on your back, using a very high pillow while you're sleeping. It can be also caused due to long hours of driving in a faulty posture. Lastly, it can also be caused in certain professionals as an occupational hazard where they require long hours of bending their neck down, like a dentist or a surgeon or certain artists where they have to look down and do their work for long hours. Common symptoms include a pain in your neck which is accompanied also by a stiff neck, or sometimes the patient feels like there are knots in their neck. There can be stiffness and pain even in your upper back or in the middle portion of your shoulder blades. And at times the patient may also present with a symptom where the pain is radiating to his upper arms, hands, up to the wrist, or there may also be a tingling numbness. So this can cause an early onset of arthritis of your neck and upper back. It can also cause an early disc degenerations in the vertebrae of your neck and upper back. It can also lead to a reduced lung capacity because your ribs are connected to your upper back, and when your upper back is stiff, your ribs cannot move freely. So it does affect the lung capacity of a person. There can be certain unusual presentations too, such as tension headache, migraines, or jaw pains. At times, if everything else has been ruled out, you can also go see a physiotherapist just to know in case the forward head posture has been a cause for these. So physiotherapy treatment in case of acute cases will first and foremost include reducing your muscular spasms of your neck by means, electrical means such as using a diathermy, ultrasound or an IFT machine. In certain severe cases, a cervical traction may also be needed. Case-specific exercise program will be prescribed by your physio. So wherein she will advise you to stretch a particular tight group of muscles and to strengthen the weaker group of muscles, because many a times there is an imbalance of muscles. Certain group of muscles tend to become more tighter in this syndrome and certain group of muscles are stretched and become weaker. In some cases, a postural corrective brace may also be advised, but please do not buy any braces on your own as the kind of brace that is needed and the way of using it has to be guided by your physiotherapist. The most simple and the most important exercise for correcting a forward head posture is called as a chin tuck. So what do you exactly do in a chin tuck? A person can place his fingers over his chin and you can just slowly thrust your head backwards. So it is this movement that has to be practiced. This can be repeated 10 to 15 times and 2 to 3 times in a day. So is it possible to avoid these kind of bad postures which lead to neck pain? Yes, it is. There are many preventive measures simple preventive measures that can be done. So let us have a look at the preventive measures or changes you can have in your lifestyle in order to avoid this bad posture. Postural awareness is the key to improve your posture and reduce your neck pain. When you're holding on to your mobile phones or your iPads, make sure that you do not stoop down to the mobile phone, but you raise the level of your mobile phones to your eye level. It may be possible either by using a mobile phone holder or as simple as propping it up with the help of few books or pillows. Implementing good posture into our everyday life is very vital for improving this bad postures. So I'm sure the next time you look into your iPad or a smartphone, you're more aware of your posture. And please correct and inculcate in your kids the right sitting habits from a very young age. To conclude, physiotherapy may not add years to your life, but it definitely adds life to those years. Stay healthy and lead a pain-free life. As you know, a pain-free life is the real key of a happy life. Thank you.